Ever get that feeling in an arm or a leg, kind of heavy or tight, and you can't quite put your finger on why?
That vague feeling.
Exactly. Well, today we're diving into a system in your body that might just explain that sensation. And honestly, it's absolutely crucial for keeping you healthy. We're talking about the lymphatic system and a condition called lymphedema.
Yeah, and what's fascinating, I think, is how much our lymphatic system does, sort of behind the scenes. We all know about our heart pumping blood, right?
Right.
But this other network, it's just as vital for our well-being, really.
Absolutely. And to get a real handle on this, we've got a fantastic resource today. Think of this as your shortcut to understanding a really detailed chapter. It's called Lymphedema, Complete Decongestive Therapy, and it's from the textbook Wound Care Essentials, Practice Principles.
Good stuff, a solid source.
Definitely. So, our mission today, for you, the learner, is to pull out the most important, maybe even surprising insights about this system. What happens when it doesn't work right, but without getting totally lost in complicated medical terms.
Yeah, cut through the jargon.
We're after those key understandings that make you go, aha, okay, I get that.
Okay, so let's start right there. What exactly is lymphedema? Laying the groundwork.
Okay, let's get right to it. So, our source, it defines lymphedema as a chronic inflammatory lymphostatic disease caused by the mechanical failure of the lymphatic system. Now, that sounds technical, I know.
A bit, yeah.
But the core idea is it's a long-term condition where your lymphatic system, it just isn't moving fluids properly like it's supposed to.
Like a plumbing backup, almost.
Kind of. And this blockage, this failure, it can happen in different parts of the body. And while it can lead to pretty significant swelling, sometimes disfiguring.
It's important to remember it's not just about the swelling itself. The lymphatic system, it has some really fundamental jobs that keep us going every single day.
Absolutely.
Yeah.
It's like the body's silent protector in a way.
Yeah.
First of all, it's a massive player in our immune system. It's where white blood cells are made and travel around, ready to fight off anything that shouldn't be there, foreign cells and whatnot.
So if we look at the bigger picture, it's a key part of our defense system.
Yeah, fly.
But it does more than just fight infections, right?
That's right. It's also totally essential for keeping things balanced in our tissues, what scientists call homeostasis.
Right, that equilibrium.
Yeah. It moves fluids around, but it also clears out waste products and, importantly, proteins that leak out from our tiny blood vessels.
And here's something that really highlights its importance, something you might find surprising. The lymphatic system handles a really significant amount of protein every single day. The source says around 75 to 100 grams.
Wow, 75 to 100 grams. That's a lot.
It is. That's about half the protein circulating in your whole body. So think about it. It's constantly working, clearing that protein away to prevent it from building up in the tissues.
Okay, that really puts it in perspective. It's definitely a busy system then. And didn't you mention it even helps with digestion?
Exactly. The lymphatics in our gut, they are key for absorbing certain fats from the food we eat.
Okay.
So yeah, immune function, fluid balance, fat absorption.
Yeah.
It's doing a lot.
Yeah.
And anything that leaves our tissues and needs to be removed, scientists call that the lymphatic load.
Lymphatic load. Okay.
Right. And if this load becomes too much for the system to handle, or, if the system itself gets damaged, that's when problems like lymphedema can start.
Now, I think it's important we clear something up that can be, pretty confusing. The difference between just regular swelling, which doctors call edema, and lymphedema.
Oh, definitely. That's a crucial distinction.
People often use swelling as just a general term, but they're not quite the same thing, are they?
Not really, no. While both involve fluid buildup, the underlying reasons for it are often different. And our source points out that patients often show up with kind of a mixed picture of both.
Ah, making it trickier.
Exactly, which can make it harder to tell them apart. It even says experienced clinicians can find it challenging sometimes.
So if you notice swelling, it could be a sign of various things, and lymphedema is just one possibility, but it's one that has specific implications for how it needs to be managed, right?
Precisely. And to really understand lymphedema, it helps to have maybe a basic picture of the lymphatic systems.
Whoa.
Is plumbing, the actual structures involved.
Okay, yeah, let's take a quick look under the hood. What are the main parts of this lymphatic network?
Okay, think of it like a really complex network of tubes and specialized stations, almost. So you have the lymph vessels themselves, sometimes called collectors, which carry the lymph fluid.
Right, the pipes.
Yeah, the pipes. Then there are the lymph nodes. Our source mentions there are something like 600 to 700 of them scattered all through your body.
600 to 700, wow.
Yeah. And these are crucial. They act as filters for the lymph fluid, cleaning it up. But they're also hubs for our immune system, housing and producing those vital white blood cells. So they're like purification centers and army bases combined.
Purification centers and army bases. I like that. So the lymph nodes are little filters and immune hubs dotted along the lymphatic routes.
That's a great way to think about it. And
Yeah.
it doesn't stop there. We also have lymphatic organs, like the spleen, which filters our blood,
Okay.
the thymus gland, really important for developing certain immune cells, especially when we're young, the tonsils, those frontline defenders in your throat, and even special patches of lymphatic tissue in your intestines called Peyer's patches.
It really sounds like the lymphatic system is deeply woven into our immune defenses, like everywhere in the body.
Absolutely, it is.
Huh.
Now, if we look at the lymph vessels themselves, the pipes, they're basically two layers. There's a superficial system closer to the skin,
Yeah, right.
and then a deeper system that drains things like muscles and joints. But they aren't completely separate. They're linked up by what are called perforating vessels.
Okay, so they connect. And where does this lymph fluid actually start? Where does it come from and where does it go? What's its journey like?
Good question. The journey begins in these incredibly tiny vessels called lymph capillaries. They're right there in your tissues.
Okay.
And they're special because their walls are more permeable, more porous than even the smallest blood capillaries. This lets larger things like those protein molecules we talked about actually get into the lymphatic system.
Ah,
They
yeah.
even have these little things called anchoring filaments attached to their walls, which help pull them open when the tissue around them starts to swell with fluid. It helps keep the entrance open, basically.
Clever design.
It is. And our source notes that because of how this initial drainage works, swelling often shows up more noticeably on the backs, the dorsal aspects of your hands and feet.
Huh. That makes sense. I think I've noticed that kind of swelling before. Okay, so from these tiny capillaries, these entry points, where does the fluid go next?
It flows into slightly larger vessels called precollectors. These basically connect the capillaries to the main collector vessels. Some precollectors even have one-way valves inside them to make sure the fluid keeps moving forward, not backward. And the ones that dive deeper into the tissues, they're really important for manual lymphatic drainage techniques as they help channel fluid from the surface down towards that deeper system.
Okay, so the precollectors are like smaller streams feeding into the main rivers, which I guess are the collectors. What are they like?
So the collectors, they resemble veins in some ways, but their walls are thinner. And a key feature is they have lots of valves, even closer together than in veins, to really prevent any backflow of lymph fluid.
Makes sense for a low-pressure system.
Exactly. And between these valves are these fascinating segments called lymphangions.
Impingements, okay.
Yeah, and these are incredible because they have their own little muscle layer in their walls. They act like tiny, independent pumps within the lymph vessels themselves. Think of them like little hearts pumping the lymph along.
Tiny pumps inside the lymph vessels. Seriously, that's amazing. How often do they usually pump?
Under normal resting conditions, these lymphangions contract about 10 to 12 times a minute, kind of a gentle pulsing.
Okay.
But, and this is cool, that rate can actually surge up to 60 times a minute when there's more fluid to move.
Wow. Like they kick into high gear.
Exactly. Think of them working harder when there's more work to do. It's called lymphangiomotoricity.
Okay, fancy word. What makes them speed up like that? What increases this? Lymphangiomotoricity.
Well, several things. Deep diaphragmatic breathing is a big one. Muscle activity just moving around. Even the pulsing of nearby arteries helps push things along. External pressure, like from massage or, crucially, compression bandages, also encourages them. And like we said, simply having more lymph fluid volume stretches the walls, which triggers more contractions. Even temperature and certain hormones can play a role.
So just taking a good deep breath can actually help our lymphatic system do its job better. That's like really practical advice.
It really is. Simple but effective.
Okay, so after the collectors, pumped along by these lymphangions, where does the lymph fluid end up?
It flows into progressively larger vessels called lymphatic trunks, and eventually nearly all of it drains into two main large ducts, the thoracic duct and the right lymphatic duct.
Okay, the big ones.
The thoracic duct is the major one. It's surprisingly long, maybe 1.5 feet, and it drains lymph from about 3/4 of your entire body, something like 3 liters every day.
3 liters. Wow.
Yeah. It runs up along your spine and empties into a large vein near your collarbone, returning the fluid to your bloodstream. The remaining quarter of your body's lymph, mostly from the upper right side, is handled by the smaller right lymphatic duct, which empties into a vein on the right side.
And I bet deep breathing helps move fluid in these big ducts, too.
You guessed it. Diaphragmatic breathing creates pressure changes that really help propel lymph flow through the thoracic duct especially. And the thoracic duct even has this little sac-like widening at its starting point down in the abdomen called the cisterna chyli.
Cisterna chyli, it really is like a whole hidden plumbing system working away inside us.
It truly is.
And we talked about the lymph nodes earlier, the 600 plus filters. Besides just filtering out junk, what else do they do?
They have three main jobs, according to the source. First, yes, filtering out the bad stuff, pathogens like bacteria and viruses, stray cancer cells, toxins, dead cells, general debris.
Okay, the cleanup crew.
Right. Second, they are crucial immune centers. They produce and store lymphocytes, those key white blood cells, and help generate and distribute antibodies that then get into your bloodstream to fight infection.
Got it. Immune function central.
And third, something maybe less known, is that tiny blood vessels within the lymph nodes actually reabsorb some water from the lymph fluid. This helps regulate the concentration of proteins in the lymph before it goes back to the blood. Oh, and an interesting side note, lymph nodes can sometimes get a bit harder or fibrotic as we age.
So they're not just passive filters. They're actively involved in our defense and even managing fluid balance right up to the end.
Okay, one last bit of lymphatic geography mentioned. Lymphatic watersheds and anastomoses, what are those about? Okay, imagine invisible lines drawn on your skin. These are the lymphatic watersheds. They divide your body into different drainage territories, each flowing towards a specific group of lymph nodes. Normally, there aren't many direct lymphatic connections across these watershed lines.
Okay, like drainage basins.
Exactly. Now, anastomoses are the connections, think of them as little detours or bypasses that do exist between lymph vessels, sometimes crossing these watersheds. Under normal circumstances, they might not be very active, but they become really important during manual lymphatic drainage, that MLD technique we mentioned. Therapists can actually encourage lymph fluid to flow through these anastomoses, to redirect it from a swollen, congested area towards a healthier area with working lymphatics.
Ah, so they're like backup routes that can be opened up when needed?
Precisely. They offer alternative pathways.
Okay, that makes sense. So now that we have a better sense of the lymphatic system's structure, its anatomy, let's shift gears a bit and talk more about how it actually works, the physiology of it all.
Right. So at its core, just to recap, the lymphatic system is a distinct circulatory system with those three key purposes: maintaining fluid balance, homeostasis, supporting the immune system, and transporting certain nutrients, especially fats, from the gut.
And it's fundamentally different from our blood circulatory system, isn't it? We touched on this, but it's worth repeating.
Absolutely. While your heart pumps blood in a closed loop, arteries to capillaries to veins and back to the heart, the lymphatic system is essentially a one-way open pathway.
Open pathway.
Yeah, meaning it starts out in the tissues with those open-ended capillaries, collects fluid, and moves it in one direction, eventually returning to the bloodstream near the heart. It doesn't circulate back out through lymphatic arteries because there aren't any.
Got it. One-way drainage.
And as we discussed, it relies heavily on those lymphangions, those intrinsic small pumping hearts within the lymphatic vessels, to actively push the fluid along against gravity and other forces.
We also mentioned how fluids exchange at the tiniest blood vessel level, the capillaries, things like diffusion, osmosis. How does the lymphatic system fit into that picture?
Okay, so at the blood capillary level, there's this constant dynamic exchange. Fluid, oxygen, and nutrients move out of the capillaries into the space between your cells, the interstitium, to nourish them.
Right.
And then waste products like carbon dioxide move back into the capillaries to be carried away. Now, most of the fluid that leaks out also gets reabsorbed back into the blood capillaries, mostly on the vein end.
Most, but not all.
Exactly. Not all of it. There's always some fluid. And crucially, those larger protein molecules that can't easily get back into the blood capillaries left behind in that interstitial space. That's where the lymphatic system comes in. It's like the cleanup crew, the drainage system for that interstitial space. It collects this excess fluid in protein, the lymphatic load preventing it from building up.
So it's making sure there's no backup, no waterlogging in that space between the cells.
You know, I've definitely felt that heavy, tight feeling in a limb sometimes, even without seeing obvious swelling.
Sure.
That makes so much sense now. It could be that interstitial space getting a bit overloaded before it's visibly swollen.
That's very likely what's happening in those early stages, yes. The interstitium actually has quite a bit of capacity to hold extra fluid before you see noticeable puffiness.
Now, Our understanding of this whole fluid exchange process, it's actually evolved over time, hasn't it? The source mentions something about a revised Starling's law.
You're right. The classic understanding, Starling's original principle, suggested that almost all the fluid that filtered out of the arterial end of blood capillaries got reabsorbed back at the venous end, with the lymphatics just picking up a tiny bit of leftover protein and fluid.
Okay, the old view.
Right. But the revised view, which takes into account the discovery and function of the glycocalyx, this sort of protective gel-like layer lining the inside of blood vessels.
Glycocalyx, okay. It paints a different picture. The glycocalyx significantly affects the pressure gradients involved. And the newer understanding is that actually very little fluid gets reabsorbed directly back into the veins at the capillary level. Much more of that filtered fluid needs to be handled by the lymphatic system.
So the lymphatics are even more critical for preventing fluid buildup, for managing that interstitial fluid than we previously thought.
Exactly. It underscores just how vital this system is for maintaining fluid balance day in, day out. It's not just handling a little bit of overflow, it's managing a significant volume.
Wow, okay. So the lymphatics are even more vital for, well, staying depuffed than we thought. Now let's talk about what happens when this intricate system isn't working as it should when there's lymphatic impairment.
Right. When the lymphatic system isn't functioning properly, it can lead to different types of what's called lymphatic insufficiency. Our source helpfully outlines three main types: dynamic, mechanical, and combined.
Okay, let's break those down. What's dynamic insufficiency? Sounds energetic.
Okay. Well, dynamic insufficiency, sometimes called high volume insufficiency, happens when you have a perfectly healthy, normally functioning lymphatic system,
Okay.
but it's simply overwhelmed by too much fluid. The lymphatic load exceeds the system's maximum transport capacity. Think of a perfectly good drainage system trying to cope with a massive sudden downpour.
Right, it just can't keep up.
Exactly. This often results in edema, or swelling, that's typically low in protein, mostly water. Common examples include the swelling you might see with congestive heart failure, CHF, chronic venous insufficiency, CVI, post-thrombotic syndrome after a blood clot, or even just from dependency, like your feet swelling after standing all day.
Okay.
Also, conditions causing low protein levels in the blood, like hyperproteinemia from kidney or liver disease, can lead to more fluid leaking out of blood vessels, again, potentially overwhelming a healthy lymphatic system.
So in dynamic insufficiency, the system itself is okay. It's just dealing with way too much volume. What about the second type, mechanical insufficiency?
Mechanical insufficiency, or low volume insufficiency, is the opposite problem. Here, the lymphatic system itself is damaged or impaired. It can't transport even a normal amount of lymphatic load effectively.
Ah, so the plumbing is broken.
Exactly. And transport capacity is reduced. This can be due to damage from things like surgery, especially lymph node removal, radiation therapy, physical trauma, or infections that harm the lymph vessels or nodes. It can also be due to being born with an underdeveloped lymphatic system, maybe too few vessels, or vessels that are malformed. This is called primary lymphedema.
Okay.
In these cases where the system itself is failing, specific lymphatic treatment, like CDT, is warranted. It's like having a drain that's partially blocked or just too narrow to begin with.
Got it. So that's a physical issue with the plumbing itself. And the third type you mentioned is combined insufficiency.
Yes, combined insufficiency is basically the worst of both worlds. You have both a decreased transport capacity, a mechanical problem, and an increased lymphatic load, a dynamic problem.
Oh boy.
A classic example is something called lymphedema. This can happen with severe long-term chronic venous insufficiency, CVI. The vein problems cause excess fluid to constantly leak into the tissues, increasing the load. Over time, the high concentration of protein in this stagnant fluid can actually damage the lymphatic vessels themselves, reducing their ability to function. So you end up with both problems compounding each other.
Wow, it sounds like these different types of insufficiency would definitely need different management approaches. For dynamic issues, maybe you focus on reducing the fluid load, supporting the system.
Right, like elevation, compression, support the veins, maybe diuretics if it's heart failure related.
Whereas for mechanical issues, you need therapies aimed at improving the lymphatic drainage itself.
Precisely. And our source also briefly mentions lipedema, which is important to distinguish. Lipedema is primarily an issue of abnormal fat deposition, usually symmetrical in the legs, and typically spares the feet. It's different from lymphedema's fluid buildup.
Good distinction. And we also touched on how things like inflammation, which increases capillary leakage, active hyperemia, and low blood protein, hypoproteinemia, can contribute to that overall lymphatic load, potentially tipping the balance.
Absolutely. Many factors can influence that balance.
Now, we've used the terms primary and secondary lymphedema a couple of times. Can you just elaborate a bit more on the difference between those?
Sure. Lymphedema is broadly divided into these two main categories based on the underlying cause. And it's worth noting, lymphedema can occur almost anywhere. Arms, legs are common, but also the head, face, neck, trunk, genitals, even internally in the intestines or chest wall after surgery.
Okay, so primary.
Primary lymphedema, as we touched on, is caused by some kind of congenital malformation of the lymphatic system itself. It might be present at birth, or it might not become apparent until puberty or even later in adulthood. The malformation could be hypoplasia, too few vessels, hyperplasia, vessels that are too large or malformed, or even aplasia, a complete absence of vessels in an area. There are also several specific genetic syndromes that are often associated with primary lymphedema, like Klippel-Trenaunay syndrome, Noonan syndrome, Turner syndrome, among others. The National Organization for Rare Disorders, nor UAD, is often a good resource for info on these rarer conditions.
Okay, and secondary lymphedema, that's the one that happens because of something else damaging a previously normal system, right?
Exactly. Secondary lymphedema is much more common. It develops as a consequence of some kind of injury, damage, or blockage to a lymphatic system that was functioning perfectly fine before.
And what are the common culprits for secondary lymphedema?
Well, in developed countries like the U.S., probably the most frequent cause is treatment for cancer, especially breast cancer. Surgery to remove lymph nodes, like axillary node dissection and radiation therapy, can both damage the lymphatic pathways in the arm or chest area.
Right, that's a well-known risk.
Yeah. But other causes are also significant. Chronic venous insufficiency, as we discussed, can lead to febrile lymphedema. Other cancer treatments, major burns, significant trauma or injuries, morbid obesity, recurrent infections like cellulitis, even procedures like using a leg vein for heart bypass surgery can sometimes damage nearby lymphatics.
Lots of potential causes then.
And globally, it's important to remember, the most common cause of secondary lymphedema worldwide is actually a parasitic infection called lymphatic filariasis. It's transmitted by mosquitoes in tropical regions, and the parasites live in and damage the lymph vessels, leading to severe swelling, often called elephantiasis in those advanced stages.
Right, filariasis. Huge global health issue. It's quite sobering, really, thinking about all the different ways this vital system can be affected. So, how does someone actually know if they might have lymphedema? What are the key signs and symptoms to look out for?
Often the first thing people notice isn't necessarily visible swelling, but rather a feeling of discomfort in the affected limb or area. They might describe it as tightness, heaviness, achiness, or increased tension.
That feeling we started with.
Exactly. While severe pain isn't usually a direct symptom of uncomplicated lymphedema itself, significant pain could suggest something else is going on, like an infection, a blood clot, or maybe a nerve issue.
Okay. And what about visible swelling?
In the early stages, you might notice pitting edema. That's where if you press your finger firmly into the swollen area for a few seconds and then release, it leaves a temporary dent or pit. However, as lymphedema progresses over time, the tissues can become firmer and more fibrotic due to the chronic inflammation and protein buildup. In these later stages, the pitting might become less noticeable or even disappear entirely.
And infection seems to be a really significant concern with lymphedema, doesn't it? You mentioned that.
Yes, absolutely. It's a major risk. Because the lymphatic system is so closely tied to our immune defenses, when lymph fluid isn't draining properly, the immune response in that area is impaired. Plus, that stagnant, protein-rich lymph fluid is like a perfect culture medium for bacteria.
Oh, dear.
So people with lymphedema are much more prone to developing skin infections like cellulitis. These can be quite serious, causing redness, warmth, pain, fever, and they can sometimes keep coming back, even if there's no obvious break in the skin like a cut or wound.
That sounds really challenging to manage. Our source also mentioned something called Stemmer sign. What's that about?
Stemmer's sign is a simple clinical test that's very helpful in diagnosing lymphedema, especially in the limbs. You try to gently pinch and lift the fold of skin at the base of the second toe or finger on the affected side.
Okay.
If you can't pinch and lift the skin there, or if it feels much thicker than on the unaffected side, the sign is considered positive. A positive Stemmer sign is a strong indicator that lymphedema is. As lymphedema becomes more chronic and progresses, you can see various changes. There could be fibrotic changes where the tissue hardens. You might see deep creases or folds forming in the skin. The outer layer of the skin can thicken, a condition called hyperkeratosis. Sometimes small wart-like growths called papillomatosis can appear. The skin might look red or discolored, erythema. In more advanced, severe cases, open sores or ulcers can develop, which can be very difficult to heal because of the poor tissue environment. And as we noted, there's often an increase in adipose tissue or fat deposition in the affected limb as well, alongside the fibrosis and sclerosis or hardening of the tissues.
Wow. It sounds like lymphedema can really manifest in many different ways, and the appearance can really change significantly as it progresses, which logically leads us to the stages of lymphedema. How is it typically classified?
Right. Lymphedema is usually classified into 4 stages, numbers 0 through 3, based on the severity of the swelling and the degree of those tissue changes we just discussed.
Okay, stage 0.
Stage 0 is often called the subclinical or latency stage. In this stage, the lymphatic transport system is impaired, maybe due to surgery or some other risk factor, but there's no visible or palpable swelling yet. However, the person might still experience those subjective symptoms we talked about, like heaviness, tightness, or aching.
So it's like the system is struggling under the surface, but it hasn't quite tipped over into visible edema yet. What about stage 1?
Stage 1 is considered early or reversible lymphedema. Now, swelling is present, and it usually pits easily when you press on it. There are typically minimal tissue changes at this point, and importantly, the swelling often decreases significantly or might even resolve completely if the person elevates the limb for a while. But they will likely have those subjective complaints too.
Okay, so still relatively early and elevation helps. Then we move into stage 2.
Stage 2 is when the lymphedema becomes spontaneously irreversible, meaning just elevating the limb doesn't make the swelling go away anymore. Stage 2 is sometimes further divided into early and late stages.
How do they differ?
In early stage 2, you might still see some pitting, but tissue changes, like fibrosis, are starting to become more evident. In late stage 2, the swelling often becomes non-pitting or pits only with very firm pressure because fibrosis is more significant. People will definitely start to notice functional limitations, and their clothing, shoes, or jewelry might feel very tight or not fit at all.
Right, becoming more problematic. And finally, we have stage 3. The source calls this lymphostatic elephantiasis. That sounds very serious.
It is the most advanced stage. Stage 3 involves very significant swelling and often dramatic skin changes. You might see deep skin folds, significant hypertrophy or enlargement of the limb, those papillomas we mentioned, widespread fibrosis and hardening of the tissues. It can be quite disfiguring. Infections are very common and often recurrent in this stage, and the function of the affected limb or body part is severely compromised.
Understanding these stages seems really crucial for figuring out the right treatment approach and managing expectations. So, when someone presents with symptoms and lymphedema is suspected, what does the clinical evaluation typically involve?
A really thorough patient history and a careful physical examination are absolutely key. They form the foundation of the diagnosis.
What kind of things are important in the history?
You'd want to know about any history of cancer, any surgeries they've had, especially involving lymph nodes, any radiation treatments, history of infections or trauma to the area, current and past medications, history of blood clots or vein problems, family history of swelling, and importantly, when the swelling started and how it has progressed.
Okay, getting the whole story. And the physical exam.
The physical exam needs to be comprehensive too. Checking their heart and lungs is important, assessing their vascular status pulses, signs of vein disease, examining lymph nodes in different areas, looking closely at the skin for any wounds, infections, or those characteristic changes like hyperkeratosis or papillomas. And then, of course, carefully assessing the affected limb itself. Its size, shape, skin color and temperature, presence of hair, checking for stemmer sign, determining if the edema pits and how easily, and feeling for any areas of fibrosis or hardening. Comparing it to the unaffected limb is also crucial.
Sounds very detailed. Are there any specific tests that might be done to help confirm the diagnosis or rule out other things?
Yes, definitely. To assess blood flow, especially if vein problems are suspected, tests like ankle-brachial indexes, ABIs, might be done to check artery function, and Doppler ultrasounds, duplex scans, are very useful for looking at the veins for clots or insufficiency. An echocardiogram might be needed if heart failure is suspected.
Okay, vascular checks.
And blood tests can be helpful too. A complete blood count, CBC, to look for signs of infection, a comprehensive metabolic panel to check kidney and liver function and protein levels, maybe thyroid function tests, TSH, or BNP levels if heart failure is a concern.
Right.
It's really crucial as part of the evaluation to consider and rule out other potential causes of edema. There's a whole list of common and less common medical conditions that can cause swelling, as well as quite a few medications that have edema as a possible side effect. Getting the diagnosis right is paramount.
It really sounds like figuring out if it's lymphedema or maybe lymphedema mixed with something else requires some careful detective work, looking at all these different pieces of the puzzle.
That's a great way to put it.
And this really underscores why having a team of experts working together seems so important, doesn't it?
Absolutely. Our source strongly emphasizes the value of collaborative, multidisciplinary care for lymphedema. Different specialists bring unique skills and perspectives.
Who are the key players usually?
Well, the lymphedema therapist is absolutely central. They're typically the ones conducting the detailed assessment, developing the specific plan of care based on the stage and individual needs, providing the hands-on treatment like MLD and bandaging, educating the patient, and assessing their functional abilities.
Okay, the lymphedema specialist.
Then you often have wound care specialists involved, especially if there are open wounds or complex skin issues. They play a vital role in differentiating lymphedema from other causes of edema and managing those difficult wounds.
Makes sense.
And vascular specialists, whether vascular surgeons or interventionalists, are also critical, particularly when there's underlying venous or arterial disease contributing to the picture. They can provide crucial evaluation and interventions for those vascular problems.
So it's really not just one doctor or therapist handling everything. It's a coordinated team effort to provide the best possible care and outcomes.
Ideally, yes.
Yeah.
That collaboration is key.
Okay, so when it comes to actually treating lymphedema once it's diagnosed, what's considered the most effective approach? What's the gold standard?
The internationally recognized gold standard for lymphedema treatment is something called complete decongestive therapy, or CDT.
CDT, okay.
And it's usually provided by therapists who have undergone specialized intensive training and certification in lymphedema management. In North America, LANA, Lymphology Association of North America, certification is a key credential to look for.
Got it. Look for a LANA certified therapist.
Yeah.
And what are the main goals of CDT? Because our source was clear. Unfortunately, there isn't a cure for lymphedema right now.
That's correct. There's currently no cure. So the main goals of CDT are really about management and improving quality of life. The aims are to reduce the swelling as much as possible, essentially trying to get the limb back towards stage 0 or latency.
Okay, decongest it.
To maintain that reduced size, long-term, soften fibrotic tissues, prevent the fluid from reaccumulating, improve function, and very importantly, prevent complications like infections and further tissue damage or fibrosis.
Okay, so it's about getting it under control and keeping it there. Now, CDT typically has two main phases, as I understand it. An initial, more intensive phase, and then a longer-term maintenance phase.
That's right. Phase 1 is the decongestive or intensive phase, and phase 2 is the maintenance or self-care phase.
Let's start with phase 1, the intensive phase. What's the focus there, and what does it usually involve?
The primary goal of phase 1 is really to maximize the reduction in limb volume, soften up any hardened fibrotic tissue, and basically mobilize as much of that stagnant lymph fluid as possible to decrease the congestion.
Okay, the big push.
Exactly. This phase usually involves daily treatment sessions, often for several weeks, depending on the severity. And it typically includes several key components delivered by the therapist.
What are those components?
The first cornerstone is manual lymphatic drainage, or MLD. I mentioned this earlier. It's a very gentle, specific, hands-on massage technique. Dr. Emil Vauder developed the original method.
Right. Gentle and specific.
Yes, it uses very light pressure, rhythmic, circular, or stretching strokes applied in a particular sequence and direction. The goal is to stimulate the lymphatic vessels that are still working and gently encourage the movement of lymph fluid away from the congested area, often across those watersheds using the anastomosis, towards healthy lymph nodes where it can be drained.
And it's quite different from a regular deep tissue massage, right?
Completely different. Regular massage uses much more pressure, which can actually overwhelm or even damage fragile lymphatic vessels in someone with lymphedema. MLD is specifically designed to work with the lymphatic system, not against it.
So MLD is about gently rerouting the fluid.
Essentially, yes. Therapists typically start by clearing the areas closer to the trunk and unaffected regions first, like opening up the drains downstream before working on the swollen limb itself. They usually treat the limb working from proximal, closer to the body, to distal, further away.
Okay. What are the effects of MLD?
Well, the main goal is reducing swelling and softening fibrosis. But it's also thought to help develop those collateral drainage pathways, stimulate the pumping action of the lymphangions, and it often has a calming analgesic effect too, potentially by stimulating certain nerve fibers.
Interesting. Okay, so MLD is component one. What's next in phase one?
The second key component is multilayer compression bandaging. This is applied immediately after the MLD session.
Bandaging. Tell me about that.
It involves applying several layers. Typically, there's a protective cotton stockinette against the skin, then layers of soft padding, like cotton or foam, to distribute pressure evenly and protect bony areas, and finally, layers of special short stretch compression bandages.
Short stretch. Why short stretch?
Short stretch bandages are crucial because they provide high resistance when you move your muscles against them. This is called high working pressure. But they have low pressure when you're resting, low resting pressure.
Okay. What does that mean for the lymph?
It means when you move or exercise with the bandages on, your muscles contracting push against the firm bandage, creating a very effective pump that helps propel lymph fluid up the limb. But when you're relaxed, the pressure isn't excessively high, making them safer and more comfortable to wear, often 200/7 during this phase. The bandages are applied with a gradient pressure tighter at the hand or foot, gradually decreasing pressure up the limb to further encourage upward flow.
Ah, clever. High pressure when moving, low when resting. And people are encouraged to do exercises while wearing these bandages, I assume.
Absolutely, that's the third component. Remedial exercises and self-MLD. The therapist teaches specific exercises that should be performed while the compression bandages are on.
Why with the bandages?
Because the muscle contractions working against the resistance of the bandages dramatically enhances that pumping effect on both the veins and the lymphatics. These exercises are usually simple range of motion and strengthening movements designed to improve circulation without overstraining the limb. Patients are also often taught basic self-MLD techniques and diaphragmatic breathing exercises they can do themselves to complement the therapy.
Okay. MLD, bandages, exercise. What else in phase one?
The fourth critical piece is meticulous skin and nail care, along with patient education on this.
Because of that infection risk?
Precisely. Prevention is key. Patients need to learn how to inspect their skin daily, keep it clean and well moisturized to prevent cracking, which can be an entry point for bacteria. Using hypoallergenic, fragrance-free moisturizers with a neutral or slightly acidic pH is usually recommended. Careful nail trimming is important too, avoiding cutting cuticles, maybe seeing a podiatrist for foot care. Acrylic nails are generally discouraged as they can increase infection risk.
Good practical tips.
And finally, the whole phase one process involves extensive patient education about lymphedema, the rationale for the treatment, and preparing them for the long-term self-management needed in phase two. Regular follow-up is also part of it, typically every 3 to 6 months once the lymphedema is stable, to monitor things.
Okay, so that intensive phase one gets the limb decongested as much as possible. Then people transition into the longer-term maintenance phase, phase two. What's the goal there, and what does it involve?
The primary goal of phase two, the maintenance phase, is exactly that, to maintain the limb volume reduction achieved in phase one and prevent the swelling from coming back. It's really about long-term self-management.
So how do they maintain it? Do they keep wearing those bulky bandages?
Usually not the multi-layer bandages long-term, as they can be cumbersome for daily life. Instead, patients typically transition to wearing daytime compression garments. Nighttime compression is also often necessary. Sometimes pneumatic compression pumps might be used as an adjunct therapy during this phase, and ongoing exercise, maintaining a healthy weight and diet, and continuing that meticulous skin and nail care remain absolutely essential parts of the lifelong management plan.
Okay, so compression garments become the mainstay. Is wearing these often a lifelong thing for managing lymphedema?
Yes, for most people with established lymphedema, some form of compression therapy is often a lifelong necessity to keep the swelling controlled.
And getting the right garment is important, I imagine.
Extremely important. A properly trained and certified lymphedema therapist, like a LANA certified therapist, is really the best person to measure and help select the appropriate garment. They come in different compression levels, styles, like knee-high, thigh-high sleeves, and can be either ready-made, off-the-shelf sizes or custom-made for individuals with unusual limb shapes or sizes. Consistent wear during waking hours is usually recommended. And there are newer options too, like inelastic garments, often with Velcro closures that can be easier for some people to put on and adjust, and garments with chip foam inserts that can help break down persistent fibrosis. Nighttime garments are also different, usually lower compression, often padded or quilted, designed to be worn safely while sleeping.
These garments don't last forever, right?
No, that's a crucial point. Compression garments lose their elasticity and effectiveness over time. They typically need to be replaced every 3 to 6 months to ensure they're still providing the correct level of support.
Good to know. We also talked about exercise being important. What kinds of exercises are particularly helpful for lymphatic health in this maintenance phase.
Continuing with the daily exercises prescribed by the therapist is key for stimulating lymphatic flow. Beyond that, aquatic therapy or just exercising in water can be fantastic,
Why water?
because the water itself provides gentle, consistent hydrostatic pressure, basically. Natural compression on the submerged limb, which helps support lymphatic drainage while you move. Plus, the buoyancy makes movement easier.
Ah, huh.
Other helpful things include exercises that activate the calf muscle pump, like ankle pumps or walking, continuing with deep diaphragmatic breathing exercises throughout the day, and some people find gentle bouncing on a mini trampoline, rebounding, can also help stimulate lymphatic circulation.
Okay, lots of options to stay active. It's good to know there are these different tools and approaches, MLD, compression, exercise, skincare forming the core of CDT. Are there any other treatment methods or modalities sometimes used for lymphedema?
Yes, there are a few other things mentioned in the source. Pneumatic compression devices, or PCDs, those inflatable sleeves or leggings connected to a pump, can be a helpful addition, particularly during the maintenance phase for some patients.
Are they a replacement for MLD?
Generally, no, especially not during the initial decongestive phase. MLD addresses fibrosis and redirects fluid in ways a pump can't. But PCDs can be useful for home management to help maintain limb size once decongestion is achieved. Modern pumps have become more sophisticated, with options for treating the trunk as well, sequential inflation patterns, and adjustable pressure settings.
Okay. Anything else?
Kinesiology taping techniques, applied in specific ways, are sometimes used as an adjunct treatment to help facilitate drainage or soften fibrotic areas.
What about medications? Are there pills for lymphedema?
This is really important. Our source stresses that diuretics or water pills are generally not beneficial for treating lymphedema itself, unless needed for a separate condition like heart failure. In fact, by just removing water, they can potentially concentrate the protein in the tissues and worsen fibrosis over time. Currently, there are no medications that can cure lymphedema.
Okay, so diuretics are generally a no-go for lymphedema fluid. Good to clarify.
Yes. Low-level laser therapy, LLLT, is another modality being investigated. There's some evidence, particularly for breast cancer-related lymphedema, suggesting it might help reduce inflammation, soften scar tissue, and perhaps improve lymphatic function, but more large-scale trials are needed.
Interesting potential future option, maybe.
Maybe. Nutritional therapy is also important, especially given the strong link between obesity and lymphedema. Referral to a dietitian might be considered based on BMI. And sometimes, if there's a significant underlying venous problem contributing, interventions by a vascular specialist, like vein ablation or sclerotherapy, can be a beneficial adjunct to lymphedema therapy. But above all, patient education remains absolutely crucial for empowering people to manage this chronic condition effectively long-term. Compliance is key.
It really sounds like a comprehensive, ongoing, and very personalized approach is what's needed to manage lymphedema effectively. Now, are there any situations where lymphatic treatment, like MLD or aggressive compression, might not be the right approach, or where you need to proceed with extra caution? Contraindications.
Yes, there are definitely some important contraindications and precautions. The source lists absolute contraindications for lymphatic treatment, meaning it generally should not be done in cases of acute deep vein thrombosis, TVT, acute infection, like active cellulitis, and untreated or decompensated congestive heart failure or kidney disease.
Okay, those make sense. Wait, no treatment for DVT. I thought compression was used for DVT.
That's a key distinction. While MLD might be contraindicated with an acute DVT, graduated compression therapy is usually warranted and recommended for DVT management. So compression's okay, but the specific MLD techniques might need to be avoided or modified until the clot is stable.
Ah, got it. Important difference. Any other cautions?
Yes, for individuals with active malignancy, cancer, or known renal dysfunction, kidney problems, while lymphatic treatment isn't absolutely forbidden, it typically requires a physician's prescription or clearance, and close communication between the therapist and the doctor is essential to ensure it's safe and appropriate.
Okay, always communicate with the medical team. We've talked a lot about the physical examination, what you can see and feel. Are there any imaging technologies that can actually help visualize the lymphatic system or diagnose lymphedema?
Traditionally, imaging techniques like lymphoscintigraphy, which involves injecting a radioactive tracer, and sometimes lymphangiography, injecting contrast dye, were used. Lymphoscintigraphy can show if lymphatic flow is slowed or blocked, but it involves radiation, and the images can be somewhat crude. Lymphangiography provides more detailed images but is more invasive.
Okay, older methods. Anything newer?
Well, the source mentions newer technology like near-infrared fluorescence lymphatic imaging, NIR-FLI. This involves injecting a special fluorescent dye and using a near-infrared camera to visualize superficial lymphatic vessels and flow in real time, non-invasively. Sounds promising for better understanding lymphatic function and dysfunction.
Wow, sounds high-tech. Is it widely used?
Not yet widely available clinically, according to the source, and still needs more research. It's different from the near-infrared cameras sometimes used in wound care or surgery, which typically look at tissue oxygenation or blood flow differences, hemoglobin, not lymphatic vessels directly.
Interesting area to watch then. Finally, before we wrap up, we should probably circle back to the connection between obesity, being significantly overweight, and lymphedema, as it seems quite important.
Yes, the link is increasingly recognized as very significant. Our source highlights histological changes seen in lymphedema associated with obesity, including increased fibrosis and abnormal adipose tissue, fat deposition within the affected limb.
So obesity can make lymphedema worse or even cause it.
Evidence strongly suggests that obesity and significant weight gain are major risk factors for developing secondary lymphedema, particularly after things like breast cancer treatment. And there's even some research cited suggesting that extreme obesity itself might impair lymphatic function enough to potentially cause a form of primary lymphedema simply due to the mechanical stress and inflammation associated with excess fat tissue.
Wow. So managing weight seems like it could be another really crucial piece of the puzzle, both for prevention and management of lymphedema.
Absolutely. It's a key factor to address.
Okay, we have covered a tremendous amount of ground today. This lymphatic system is way more complex and important than I think most of us realize. Can we try and quickly summarize some of the absolute key takeaways for you, the learner, listening in?
Let's do it. So fundamentally, lymphedema is about an imbalance. The amount of fluid filtering out of capillaries into the tissues is greater than the lymphatic system's capacity to drain it away.
Okay, imbalance is key.
Common reasons for this imbalance include injury or obstruction to the lymphatics, often from cancer treatment like surgery or radiation,
Right.
severe chronic venous insufficiency, and, as we just discussed, obesity is a major contributing factor as well.
Got it. And treatment.
Early intervention with complete decongestive therapy, CDT, especially manual lymphatic drainage, MLD, and compression, is really key for achieving the best outcomes. Compression therapy, in particular, is often underutilized, but is absolutely fundamental to long-term management.
Don't skip the compression.
Definitely not. Care for lymphedema is usually managed in outpatient clinics or specialized wound care centers, ideally by a multidisciplinary team.
Teamwork makes the dream work.
Something like that. And while there's currently no cure, the crucial takeaway is that with consistent, appropriate treatment based on CDT principles and a dedicated long-term self-management plan, significant improvement in swelling, symptoms, and quality of life is absolutely possible. People can gain control over the condition.
That's a really hopeful and important message. And to really illustrate how this can work in the real world, our source even included a couple of brief patient scenarios.
Yeah, those are good examples.
One was a 58-year-old man who had both chronic vein problems and lymphedema, plus a history of cancer. He underwent CDT, saw a really significant reduction in his leg swelling measured by girth, which then allowed him to successfully have treatment for his underlying vascular issues.
It shows the synergy between treating both.
Exactly. And the other was a 60-year-old woman with CVI, non-healing leg ulcers, and lymphedema. She also had great success with CDT. Her wounds actually healed, her limb decongested significantly, and interestingly, she even lost weight during the process, all without needing diuretics for the swelling.
Yeah, those cases really highlight the potential benefits of that comprehensive CDT approach and how vital it is to address both lymphatic and vascular issues when they occur together.
Absolutely. So to bring it all together for you listening, remember that your lymphatic system is a vital, hardworking part of your body that maybe doesn't get the attention it deserves. Lymphedema is a chronic condition, yes, but it is manageable with the right knowledge and the right approach, primarily complete decongestive therapy.
And having that collaborative healthcare team, especially a certified lymphedema therapist, working with you is essential for navigating it successfully.
Which leaves us with a final thought for you to ponder. Consider the incredible, intricate balance within your own body. How might seemingly small issues or even lifestyle choices have far-reaching effects on complex systems like your lymphatic network?
Yeah, what choices might be unknowingly impacting your lymphatic health every day? This deep dive really has just scratched the surface. There's a whole world of understanding still to explore about this fascinating and Absolutely crucial system.